Good afternoon, everybody. Happy Friday. Nice to have a sunny day. A little warmer temperature. I just was outside coming back from our vaccination event, and we'll talk about that in a minute. But I know it's not that warm out, but feels like a nice warm day. So we're going to talk about COVID today, of course, the vaccine. I'm going to talk about a couple of things that are going on in terms of new projects and development momentum, and then of course we're going to take your questions. So the news continues to be good. The city of St. Louis is averaging about 31 cases over the 7-day average per day, and yesterday we had 24. Tuesday we had 34. So we are averaging 31 cases, new cases a day, 7-day average. Hospitalizations, also good news there. These hospitalization numbers, as you know, are numbers for the region, 4 major hospital systems in the region. Currently hospitalized, 342 people who are COVID positive or suspected positive. Of those 342 people, 80 people are in the ICU. So about 25% of those folks are in the ICU, so they're pretty ill. And of the folks in the ICU, 59 people are on ventilators. So 2/3 of the people in ICU are on ventilators. Again, that's a very serious situation. Patients admitted to the hospital, 7-day average, we're averaging about 41 people a day being admitted. We had a low reported on Sunday of 31, and these numbers all lag 2 days behind, you know that. But so we're running about 41 cases average per day. So all of these numbers are so much better than they were, even if you look back, just looking back 30 days ago on January. What is today? Is it the 19th? I think it is. Look back to the 19th of January. And we were averaging 80 cases a day, and now we're averaging 30. We had 716 people in the hospital. Now we have 342. We had 141 people in the ICU. Now we have 80. And we had 88 people on ventilators, and now we have 59. So that's all occurred just within the last 30 days. And we are very, very hopeful that that will continue, that we'll be able to sustain these lower levels and even go lower. We know that back in the summer, we saw some very good numbers like this, and we actually thought we had turned the corner on this COVID. And within a few weeks or a month, we were seeing our second big spike. So very, very hopeful that that does not happen this time. There's some, good things going on. Of course, many more people are wearing a mask now than they were last summer. Understanding the effectiveness of wearing a mask. Some of you know that the CDC has even said, well, maybe you should wear 2 masks. Double up on them. I think that's great. I see some people doing that, but just this mask wearing is a really effective. That's why we also don't have any flu, hardly any flu this winter. Or even was talking to some parents who have young kids, and those of you out there that are moms or dads for that matter, but know that when you're in December, January, and February, your kids have the sniffles, and then you get it, and then the other kid gets it, and that goes round and round, and that has not been happening this year. So attributable also to just more people being distanced, wearing a mask, washing their hands, using the mitigation strategies. So our numbers are good now, and we are crossing our fingers that those numbers will be sustained and even move lower. Vaccinations, as I mentioned, at the start, I just came back from our vaccination event that is going on. This is a second dose vaccination event. Some of you will remember that 3 weeks ago we vaccinated about 4,500 people on Thursday, Friday, and Saturday. Most of them were police officers, firefighters, EMS workers, corrections, sheriff, first responders, healthcare workers. So those folks are, this was the Pfizer vaccine, and those folks are getting their second dose this Thursday, Friday, Saturday. There are no first doses today or tomorrow. We vaccinated a few police officers, firefighters on Thursday that were unavailable 3 weeks ago. But other than that, this is completely a second dose event. Today, so far, when I left there just about 20 minutes ago, we had vaccinated 1,383 people. This event goes on for another couple hours, two and a half hours, I guess it is. And so, and then also tomorrow. It's very encouraging, I think, to have all of our first responders, healthcare workers now have 2 shots to be fully vaccinated instead of half vaccinated. So we're very encouraged by that, and just happy that we're able to get that done. And of course, we're also vaccinating. We vaccinated about 1,000 members of the public last 3 weeks ago, and they will get their second shots tomorrow as well. We are expecting to be able to hold another vaccination events, probably a couple of them. We're going to move the location, hopefully a little better for most people. We are nailing down right now a location that is in North City and a location that is in South City to make it more convenient for folks. And we hope within the next week to 10 days we will we'll announce it before then, but we will have an event for North and for South. We will be working off of our registration list. And we've got 54,000 people on our registration list, of which, and that number's a few days old, so some people have probably signed up since then, of which about 44,000 are city residents. So we will be doing invitations for these 2 events, and we'll likely do it by zip code. Okay. And so more to come on that. Also on the vaccination front, you know that yesterday, and this was two of them were in the city. They're doing a few. Those of you that are searching for a place to get a vaccination, I would suggest continuing to check the Walgreens site. They don't have a lot of vaccine, but they do have some, and it's by appointment only, and it's not all the Walgreens. It's only 2 of them in the city. We expect that this next week there'll be one it's at Natural Bridge and Kings Highway, I believe is 30, I don't have the address, 38 something North Kings Highway. So, but just go online, because it asks you to put your zip code in, and then it'll show you where there might be appointment available, and just, you can go wherever. It's just another option. Tomorrow, as you know, St. Louis County is doing a vaccination event at UMSL. They are fully subscribed, I believe, but this is one of those things that you just kind of have to stay on. The hospitals are doing vaccinations. The hospital's got 30,000 doses this week. So it's getting better. What we see is that the city is supposed to be getting 900 vaccinations per week. And so we're seeing that beginning to happen. And I think we were actually supposed to get 900 a day, and delayed a little bit because of the snow and all that sort of thing. So the supply is beginning to lift a little bit. I think in a month we'll be having a much different conversation here. I certainly hope so, and all information points to that. So that's good news. Let's see here. Just a couple things that are not COVID related that I wanted to mention to you. it was announced yesterday, I believe, that the Butler Building, many of you may not know the Butler Building, but it's at the corner of 17th and Olive. Big building, 700,000 square feet, historic building. It's 100 years old. And that is announced that is going to be redeveloped, most likely into apartments. Greater St. Louis Inc., which is a newer organization, which is came together with a number of downtown St. Louis, Civic Progress, RCGA. That organization has made an investment in that building, along with the developer, of course. And so we're excited that people are continuing to invest. I mean, this last year has been rough on every business and rough on development as well. But as we come back out of this year of COVID, there are some very encouraging and positive signs. And you know, why do we care about development? Well, we care about it because the project is a lot of jobs for people. The project is ongoing jobs after the construction, but the construction's a lot of jobs. We're expecting Jefferson Arms to begin here within the next 6 months or so, we think. So there's a lot of very positive economic development signs, and I think between that and also between what we're seeing right now happening in Congress, and it looks like there may be some funding coming to local governments, cities and local governments, to replace the millions and millions of dollars that we have in lost revenue, which has significantly impacted our ability to operate over the last year. But, you know, within a month, perhaps, we will know what sort of revenue replacement we get and what kind of funding that we will be getting from Congress. Of course, that bill is in the House right now. Expect it to, hope that it will pass. Don't want to be overly optimistic here, you know, within the next week or so. Then go over to the Senate. That there's help for people, individual help for people with additional stimulus money there. There's additional rental assistance. There's help for cities. There's a lot of additional assistance because there is all local governments and state governments for that matter, but all local governments have been very impacted by the reduction in revenue, the reduction in sales tax. There's been virtually no hotel tax. There have been no conventions. There's people aren't eating at restaurants. You think about all the sources of revenue that the city has, and those have been way off this year. And so as we struggle to provide good service and to make the repairs that we need to make and all those sorts of things, it's very important that we help our economy come back out of this with development projects and also with some stimulus from the federal government. So I'm optimistic about next year in terms of the city's ability to do some of the things that we have been unable to do this year because we just simply have not had the revenue. So I know many of you have been impacted too. Many of you have lost your jobs. Many of you have had your hours reduced. And when that affects you, that affects us as well. So just a little diversion there. I also want to mention one thing which I think, I mean, a lot of positive things, but an additional thing, and that is Arch Grants announced yesterday that it would, it was endowed with $21.5 million, I think it is. I'm going to give you a couple of numbers here for those of you who don't know what Arch Grants is. Arch Grants is an organization that has, sorry, I can't seem to hit the right button on my phone, but, and here it is. All right, an organization that, you know, has really been building a future economy for St. Louis by investing in startups and startup companies through game-changing entrepreneurship, investing $50,000, not a huge amount of money, in a really small startup company. And over the last, since it's been going, it's probably 7 or 8 years, they have funded 173 companies to get started. And one of the components of Arch Grants is that those companies have to either be already located in St. Louis or agree to move their company to St. Louis. And there have been a number of success stories out of that. So 173 companies have received that startup grant. It's not a loan, it's a grant. There's no strings attached to it. these small startup companies to use that to really launch their idea. There have been over 2,000 jobs created as a result of that, and $307 million in follow-on capital. So, meaning somebody else then came in and invested the big money. So Arch Grants announced yesterday over $21 million endowment to keep that going, so that they can help more startups and so that they can provide even more funding for those startups. That's a real game changer, has been a real game changer, and will continue to be a real game changer for St. Louis and for our economy and for the people who live here to have jobs and good jobs. So those are just a couple of things I wanted to digress from talking about COVID for a minute to talking about some of the positive things that are going on. So I bet there are questions.
Okay, starting with COVID-related questions.
Back to COVID.
A few questions asking about the Walgreens vaccination. Leslie has a question about, is there a list? Did Walgreens publish a list? And when signups can become available, since they do go so very fast?
Walgreens did publish a list of locations. And I think the signups are, they haven't said exactly when the signups will be, but check their website because there's information there. Yesterday, as I think I mentioned to you, yesterday morning we learned about it. By noon or 1 o'clock, all the slots were gone. I saw a couple people on Facebook or Twitter, one or the other, that said, hey, we just got lucky today. We were checking all the sites and we checked the Walgreens site. So what these doses are doses that the state, take you back a minute, you remember at the beginning of this, the Walgreens and CVS were tasked with vaccinating both employees and residents of nursing homes. And the state and the government made an estimate of how many doses those would be. Well, as it turned out, not everybody in the nursing home was willing to get the vaccination, and not all the employees were willing to get the vaccination. So there were some doses that had been allocated to that, which are now being repurposed, if you will, to vaccinate the general public. And that's where these doses are coming from. You also probably remember that I did write a letter to the governor, it's been about 2 weeks ago, telling, when the state announced that it would be Walmart and Health Mart that would be the vaccination sites in Missouri, I pointed out to the governor that there are no Walmarts in the city of St. Louis, and there were 3 Health Mart drugstores. Health Mart's an affiliation for drugstores, but they were small. They're good drugstores. It's great. We're happy that they're in there, but that predominantly we needed to be able to be vaccinated at Walgreens or at CVS or places where most of us get our prescriptions. So this was the first small step. We are hopeful that CVS will also be able to come online shortly and have a vaccination program with some sites here in the city of St. Louis. Maybe the CVS that you always go to, or the one that's not far from where you live. And so we are still working on that, but this Walgreens announcement yesterday was small step. It doesn't solve everything, but it is a small step to getting more shots in arms, which is really what this is all about.
Sandy is watching and has a question about the general public and when the city thinks the general public might be able to have access to vaccines.
Sandy, I don't really know that answer, but I think it's still a ways away because right now, most of the vaccinations are going, well, all the vaccinations except for hospital workers, healthcare workers, and first responders. The next tier that is being vaccinated now are folks over 65 and folks that are between 18 and 64 but who have underlying health conditions. So there are a lot of people that are over 65 or who have underlying health conditions. So we have to get much more through that population. The state will actually make that determination. It's not something that will be made here at the local level. We get our vaccine from the state. We have to follow the state's rules. I think it's reasonable, even though I understand that everybody wants this vaccine, or certainly a lot of people do. So over 65 and those folks under 65 who have underlying health conditions are what is the tier that is eligible right now. Johnson & Johnson vaccine, may be approved in a week or 10 days. The production of the vaccine is really ramping up. We expect for the state and therefore us to get more and more vaccine each week. And so this is a situation where I hesitate to predict when just anybody with no underlying health condition will be able to get the vaccination. But it's probably months away, a few months away. So I did guess, I'm sorry, but I hope it's sooner. But, the vaccine does a couple of things. The most important thing it does, according to the trials, is to keep people who get the virus And so that is the most important thing here, because the worst outcomes for someone who gets the vaccine are people over 65 and people who have underlying health conditions. And so being able to vaccinate as many of those folks as possible will keep people out of the hospital and will keep people from dying from this virus. And then next is onto the general public. If you look at the state's website or the city's website for that matter, you'll see that the next tier is called Phase 1B Tier 3, and that is teachers and child care workers and a number of essential workers, grocery store clerks. So that's next, but that is a ways off. And, I understand and I agree that teachers need to be vaccinated, and I hear from a lot of people about that. And, the struggle with that, I agree with that. Teachers do need to be vaccinated. The struggle is, should a teacher get the vaccination instead of a 75-year-old with, COPD? We're still having to make that choice right now. And I absolutely agree teachers need to get vaccinations. We just have to get through these folks that are older and folks that have underlying health conditions.
We have questions from folks who have signed up on the city's notification system and have since been vaccinated elsewhere. Do they need to remove themselves, or will they not be contacted, or just ignore the notification if they get notified?
Just if you are notified, there'll be an option where you can say, hey, I already got it, take me off your list. If you are notified, just do that. Otherwise, don't worry about it. We know, there are people out there that are on 10 lists right now probably. In different counties and different hospital systems. And so don't worry about that. We know that people are getting vaccinated where they can, and we encourage that. So no worries.
On unrelated COVID vaccine and related to weather and cold, Eric is asking about water main breaks over the last several days. How is the city doing on that? When do we expect them to be repaired?
So Eric, we just met on this morning. Kurt Scobie, who's the water commissioner and director of utilities for the city, said that within the last week or so, we've had upwards of 50 water main breaks. Now the big one was at Grand near St. Louis University. It actually closed Highway 40 for a little while one morning. And while they repaired it, that one is repaired. They have fixed many of them, but not all of them. And here's the other piece of news. You may already know this. When the pipes start to thaw is often when they break. So I don't necessarily can't explain the physics of that. But, if some pipes are frozen now, we've had a number of buildings in the city that have had some water main breaks. At the airport, the airport has a lot of lower level services with pipes on outside walls. They've had some breaks. They're in the process of cleaning that up now. So I know lots of people who've, the pipes under their kitchen sink broke. And so I think I saw this on the news the other night. One of the weather folks said that we had, and this was day before yesterday, I think, we had 6 days consecutive days of where the temperature never got above 19. And that long of a stretch of that cold weather had not happened since 1936, according to the weather guy. And so, this was a sustained, really frigid cold snap. We all remember having, a couple of days when it was 0 or below 0. But this 6-day stretch has been a tough situation on pipes and people and cars, car batteries. So it's going to warm up though. It's supposed to be 50 on Tuesday. Is that right? Is that still true?
Almost 50.
I hope so. Pretty close to the end of February, so winters always used to be like this, or it seems like they did anyway, with a lot more snow. And, so we haven't had much of that lately. But thanks to everybody for their patience. And, I hope you all are doing well, and appreciate you turning in this afternoon. Thank you so much.